Fergus Cullen. I'm the Executive Director of the Connecticut Yankee Institute, which is Connecticut's independent think tank dedicated to free markets, free enterprise, and private sector solutions to public policy questions. We're located on the campus of Trinity College here in Hartford, and we research issues and develop and advocate private sector, free market, market-based policies in support of limited government and lower taxes. I'm joined today by Bill Carew, with a small business owner, Paul Smith with the Health Insurance Underwriters Association, Andy Markowski with the National Federation of Independent Business, Dale Kay, who is the operator of Partitions Incorporated, and also Dave Caffro with the Connecticut Benefit Brokers is here as well. And what I'd like to do is talk about a survey that we at the Yankee Institute fielded recently, just dealing with healthcare issues, specifically the national healthcare changes that are being considered in Congress and how Connecticut residents feel about them. One thing we found, first of all, that Connecticut residents oppose the current bills being considered in Congress by a 51 to 34% margin. By a margin of 62 to 29%. Connecticut residents believe Congress has rushed the process and that they should take more time to get it right. More than 3/4 of voters, 77%, say they are very concerned or somewhat concerned that changes in health care will result in more government spending, higher taxes, and bigger budget deficits. A full 61% of Connecticut residents describe themselves as very concerned about these possibilities. Half of state residents say that changes to health care will do more harm than good. By a nearly 2-to-1 margin, Connecticut residents say Congress has been too ambitious. They favor smaller, more incremental reforms to a major overhaul. And residents are also concerned about proposed expansions to Medicaid that could be paid for by state taxpayers. Residents oppose expanding Medicaid by a margin of 49 to 26%. We also asked about some of the proposals for how to pay for the healthcare overhaul. A large majority of residents oppose taxing health insurance. 77 to 9% oppose taxing health insurance. We didn't distinguish between so-called Cadillac plans and other plans, but it seems clear that voters recognize that a tax on health insurance will only drive up premiums and costs. In addition, a large majority are opposed to taxing people who don't have insurance by a 59 to 27% margin. This is the so-called individual mandate, and it is included in both the Senate and the House versions of the bills that have advanced so far. Residents are also opposed to taxing businesses that don't offer health care by a 44 to 31%. This, of course, is another mandate. Now, I do want to mention methodology. This poll was conducted on the evenings of January 12th and 13th. It's important to note that this was last week prior to the election in Massachusetts, which so dominated news coverage. It included a sample of 1,526 people. These are registered voters in the state of Connecticut. And like Gallup, that's the same methodology, by the way, that's used by Gallup. We have released the full, complete survey. We believe at Yankee in transparency, so you can see the exact wording of the questions, you can see the exact order in which they were asked, and if some of the wording and the language sounds familiar to you, it's because we try and use language used by Gallup or the Wall Street Journal NBC poll whenever we can to get consistency. And I also want to stress that we at the Yankee Institute, we're a free market think tank. We are for healthcare reform. We are for change. We are not defending the status quo. We support the goals of getting higher coverage and lower rates for everybody. We just think that there are better, more efficient, effective ways to accomplish these goals that don't rely on big government solutions. For example, we're in favor of making it easier for consumers to purchase health insurance across state lines, just like you might with your auto insurance. We believe in having incentives for young, healthy people to buy insurance rather than going without. We're in favor of incentives that combat adverse selection, the idea that you only get insurance right before you know you're going to need it for something. We're in favor of healthcare savings accounts to give people skin in the game. We're in favor of fewer mandates at the state level. And we're in favor of real tort reform as well, so that doctors and practitioners don't have to practice defensive medicine. So we are for change, we are for reform, but the people of Connecticut are clearly deeply skeptical about some of the changes being proposed in Washington right now. And with that, if there are other questions a little bit later regarding the survey, I'd be happy to answer those. I'm going to turn over now to Andy Markowski with the National Federation of Independent Business to speak from a business perspective on this. Andy.